Welcome to the Simply Pediatrics Podcast, simplifying holistic healthcare for infants and children. We're so glad you're here. Join Jennifer Zethner, holistic pediatric nurse practitioner and holistic mom of 3 on a mission. Listen in as she shares the answers to the most asked questions from parents in her practice every day and offers parents practical strategies and actionable steps to support their child's health and well-being. Enjoy this insightful episode of the Simply Pediatrics Podcast and stay tuned for more information at the end of the podcast. Today's episode, co-sleeping.
Hello and welcome. I'm so happy to be here with you today. Today we are talking about a controversial topic that hits at parents kind of like emotionally often in my office, and that is co-sleeping. It seems to be a variety of situations that I meet in my office where I have parents who we're co-sleeping and they tell me matter of fact and they're both thrilled and they love it and all good. And then I have parents who say it like, well, the baby's still in the bed with us. And then you can hear the tone of their voice where they feel bad. And I don't know if it's because they feel bad because they don't want the baby there or if one of the partners doesn't want the child there. And then I try to figure that out. And I ask questions like, who else is sleeping there? Is dad in the bed? Is mom in the bed? Is everybody happy with this arrangement? And then I try to get some more information there. And then I have families who are like, absolutely not. We're not co-sleeping. The baby's, in the crib or even in another room. So I just want to normalize this for you, you U.S., you American moms and dads out there. So many other cultures in the world, it's just completely normal to not only share a bed, but often to share the same bedroom. And that's not just because of economics, because they don't have other bedrooms. It's because other cultures are very aware of the fact that children want and need to be close to their parents even when they're sleeping. So we all need to get rid of this guilt and shame. We have this great amount of guilt and shame as adults when we are still co-sleeping with our children. And whatever that looks like, whether they're co-sleeping in the bed or they're co-sleeping, in the bedroom on their own beds. This is very normal. Now, for any of you who are not comfortable co-sleeping and are not comfortable, bed sharing or even room sharing, that's also okay. Everybody just needs to come to a place where it's at their comfort level, right? And not to shame others. You aren't doing anything wrong by putting your child in their own room. I will tell you that you might have a harder time getting your child to sleep through the night. Kids tend to have a difficult time in their own room. A good tip, if you do not want children in your own bedroom, is to have your children co-sleep together. So having your children sleeping in the same rooms often is very helpful for children to help them to sleep better through the night, knowing that their sibling is in the same room with them. Putting your child in their own room is not as easy as it sounds. And parents struggle through that and just know that that is really normal. Kids really don't want to be by themselves. They do prefer to be by us until, it's like the school age years. Really, children are still looking for that comfort of knowing that mom and dad are close by. Now, if I meet a couple, and this is where it gets a little uncomfortable for me as a provider. But if I meet a couple and it's very clear that mom is very much enjoying co-sleeping because it helps her to sleep through the night. She's getting rest, the baby's getting rest. But dad is obviously uncomfortable with this. That's really not okay for your children. Whether they can talk or they can't talk, your kids can feel emotions, right? Our children are the barometers of our household. And they can feel and sense our emotions. So if mom and dad are not on the same page with this, you really need to get on the same page, whether that's convincing the other partner that this is what's best right now, or, meeting in the middle by, sharing the bedroom instead of just the bed, or figuring out a way that both parents are content. Because when we have animosity, resentment going towards mom or towards the child, and sometimes we do, that is not healthy for anybody. It's not healthy for the marriage, and it's not healthy for the child bonding with either partner. So moms and dads, I know this is a really touchy topic, but look at it and understand that you're not doing good for anybody if there's a partner in that relationship who's not happy, because our kids can feel it. I'm really surprised by the amount of parents I hear from in the first 3 months of life who will text me like it's something very urgent, and I understand it's urgent to them, that their child will not sleep in the crib, the bassinet, or the cradle by themselves at night. I don't know where we got the idea that our children are supposed to sleep by themselves, especially in those first 3 months of life. Moms and dads, your baby was inside of mom for 9 months. 9 months. They do not want to be away from mom at all. Just because it's nighttime and you want to be in your bed, we just assume we're going to put our baby in the crib or the cradle or the bassinet next to us and they're going to go to sleep. Nope, that's not close enough. I know they're in the same room. You'd think it would be fine. It's not close enough. It is very, very unusual for an infant to fall asleep by themselves in their own space and sleep through the night. Never mind, babies don't sleep through the night and fall asleep by themselves. They want to be near us. They want to be on top of us, close to us as possible, as close as they possibly can, especially if they're breastfeeding. Studies have shown, please keep your babies close to you. Don't feel bad about it, and stop thinking that just because you saw that baby on the internet sleeping comfortably in their crib for hours at night, that's normal. It is not. It is not normal. Babies need to be near us. And just know that you're not creating a dynamic that you won't be able to break when and if you would like to take the baby out of your bed and put them into their own space. For those of you with younger babies, right, so our infants out there, and you are co-sleeping and you're hearing from family members, oh, you're going to spoil them, and you actually don't even want to go on to have a toddler who's sleeping in your bed, but you're so exhausted and the only way to get some rest with your infant is to co-sleep, then certainly, moms, certainly co-sleep with your baby. Do it safely. Speak with your provider about how that can be done. It's dependent on what your sleeping arrangements look like. But co-sleep with your baby. Sleep is so important. And particularly in those first 6 months, infants really do need and want to be close to us, particularly if we're breastfeeding. This is very normal. And you're not going to form a habit at those young months that you won't be able to break later on if, in fact, it's not your goal to have a child sleeping in your bed. So don't feel guilty about that and don't worry about that, because sleep is so, so important. And our infants being close to us, absolutely, studies show that moms and babies sleep better. Their heart rates get regulated with ours. Their body temperature does. They nurse well. They rest. They sleep. And so does mom. I can attach some articles to this podcast to give you some reassurance and also some other information about what other cultures do and how it's much more normal in other places outside of the United States. All right, moms and dads, drop the shame, drop the guilt over co-sleeping. Enjoy your rest if that is what you choose to be doing. Remember, parenting is a journey and you're doing an amazing job. Stay curious and keep learning, and I'll see you next time.
Thank you for joining Jennie on the Simply Pediatrics Podcast. We hope that the valuable information she shared in this episode will inspire and empower you on your holistic parenting journey. If you would like to learn more about Jennie, her Simply Pediatrics practice, or anything that she spoke about today, please check the show notes that accompany this podcast and you'll find all the links and resources you need. You can also sign up for the Simply Pediatrics mailing list so that you receive Jennie's weekly newsletters packed with vital information and holistic parenting journeys. If you've enjoyed today's episode, please consider giving this page a like and subscribe to the channel so you don't miss any episodes. And don't forget to connect with us by sharing your thoughts in the comments section below. Follow Simply Pediatrics on any and all of the social media platforms. And if you're interested in an in-person or a virtual appointment with Jennie, please see the contact details in the show notes. Stay tuned for more episodes packed with a wealth of powerful information to support you on your holistic parenting path. See you next time.